life. Yes, we're great. Hello everybody, Dr. Garrett Wegerif here at Pure Plastic Surgery for another Thursday Thoughts. This week I posted something on Instagram, a result before and after that generated quite a bit of discussion, and so I thought it would actually be a good topic to bring up today to kind of go over some of the points that people had questions about regarding this. And the post was about an abdominoplasty I did on a young lady who requested not to have her belly button placed back during the procedure. And this is actually something that is not the first time I've done this, but it's uncommon, and it's only if a patient happens to request it. But looking at her before and after pictures, she has a great before and after. She just has the absence of a belly button down there. And this was per her request. I didn't bring it up. It's something that she was interested in having done. You can see she has some nice tattoos, and so she's interested in body modification, and for whatever reason she didn't want to have one. And so this generated quite a bit of questions. So let's talk a little bit about our belly button, what it is, what purpose it serves, and what are the options for it when we do different surgeries, particularly abdominoplasties or tummy tucks. So what is it? First of all, it serves a purpose in utero. It is actually the veins that connect the fetal circulation to the placenta and the maternal fetal circulation that gives you all the nutrients and oxygens you need during development. And so it's 2 arteries and 1 vein, and immediately after birth, that umbilicus is ligated and those blood vessels eventually fall off. So it serves a very important purpose during fetal development, but after that, it really serves no purpose at all, other to be a indication that you did not come from immaculate conception, or to put a belly button ring, or to be scrutinized over an abdominoplasty. So that's the purpose of a belly button, and it is not needed. I had a few people asking, don't you need a belly button? No, you don't. And so what happens to your belly button during some of the procedures we do, like a tummy tuck? For a traditional tummy tuck, we're making a nice low incision in your underwear line, and then we're elevating all that skin and fat all the way up to your xiphoid process. So we're taking all that skin and fat off of your muscles and elevating it up to here. Your belly button is attached to your deeper structures by a stalk. And we typically divide around the belly button by cutting a little hole around it and elevating that skin and fat around it. And then there's little perforators that go up the stalk of the umbilicus to supply its blood supply. And traditionally, we pull all those tissues nice and tight, and your belly button stays in the exact same location because it's connected by that stalk or its little trunk, and we pop it out through a new hole higher up on the skin flap after we pull everything nice and tight. So if someone chose not to get a belly button or wanted to have it after their surgery, it can be removed just by dividing it low at the stalk. Sometimes there's a small umbilical hernia that we need to repair at the same time. And there's actually, certain patient populations, it's beneficial to not have it in cases where we're doing like a paniculectomy, which is removing for weight loss patients, literally just removing the overhanging skin and not really doing a traditional tummy tuck, especially ones with comorbidities like diabetes and stuff like that, because it's one less incision that can potentially have a problem. Anytime we make an incision, there's, potential issues with wound healing, infection, other things like that. So if you're a high-risk person, you may not choose to do that. And then nowadays, there's actually some high-profile plastic surgeons that are choosing to delay a belly button. They're not keeping the person's original belly button, and then they're actually creating a belly button a few days after their tummy tuck. One of the reasons being, again, this is an area where blood supply is coming down to heal this big incision down here. And by not cutting that little hole there, there's a little additional blood supply that helps everything heal. And this particular surgeon, Dr. Hoyos, who does a lot of body contouring stuff and does some amazing work, he just goes back a few days later after the initial surgery and does an umbilicoplasty, which is creating a new belly button. So with all that being said, if this patient chose in the future that she wanted to have a belly button, there's actually surgeries to recreate them. And so, we talked about the traditional tummy tuck where we cut around the belly button, pull everything tight, and it pops out through a new hole. For a very select few patients that are good candidates for a mini tummy tuck, or what we call an umbilical float, when they only have a little bit of lower laxity and a little bit of a diastasis or a bulging of the muscles in the lower part of their abdomen, we can actually do what's called an umbilical float, where I don't cut around the belly button. I just make the incision down below, and I actually divide that stock, and it lowers your belly button a few centimeters when we tighten up that skin. So you need to have, a select patient to meet those criteria. They need to have overall relatively high belly button so it doesn't look weird when it drops down a little bit. And they also can't have a lot of skin to remove. So there's not too many patients that qualify for that, but there are some. All right, so I hope that clears up some people's questions and concerns about belly buttons. And the final thing I want to add to all of this is just a point of being nice to people on the internet. A lot of people said they would never choose to not have a belly button, but that's not their choice. In plastic surgery, we do a whole broad range of things for different patients. Some patients want huge breasts, some want a breast reduction, some want a very natural BBL, some wants a more exaggerated one. Each different person has their preference, and especially for my patients and on my social media pages, I really ask that if you have something to say that is not particularly nice, please keep it to yourself, or if there's something about the technique that you generally have questions about, but it might be offensive to the patient that you're critiquing, send me a direct message and I'll be happy to talk to you. But I just want to keep it friendly and inclusive for the people that are, viewing my page, and the patients that we operate on that are really happy with their results. Do we have any questions?
Yes. I'm living in Boston. Is it possible to have a consultation with you online, or I have to send some photos?
Absolutely. So yeah, that's the process. We start with a virtual consultation. So go to pureplasticsurgery.com, and immediately there's a little box where you can start the process and send in some photos. And then we can have a virtual consultation over Zoom to get things started. But I always meet my patients before surgery, at least the day before surgery, for an out-of-town patient.
Another one. Hi. I have breast implants that need to be changed after 12 years.
All right. So it's a reasonable thing to replace your breast implants at 12 years. The rough guidelines are by the industry that creates the breast implants. They guarantee them for 10 years, and most patients, start thinking about replacing them around that time. I always tell my patients, if you're not having any problems and you're doing the recommended screening, which is getting either an MRI or an ultrasound of your implants, assuming they're silicone implants, that you don't need to strictly adhere to that 10-year rule, but you should definitely start thinking about it in the 12 to 15-year rule, because it's better to replace those implants before you have an issue like a rupture. So 12 years is a reasonable time to start looking into that.
What if your loose skin is in the upper abdomen and not need the lower abdomen area? Does this still require a tummy tuck?
So we have a few approaches to this, and something that's kind of gaining popularity more recently, especially if you're doing this in combination with a procedure like a breast lift. Then we may be able to offer you an upper tummy tuck or a reverse tummy tuck, where we actually hide the scar in the fold of the breast, where you're also going to be getting a scar from your breast lift. So if that's something you're a candidate for, we have to examine you to make sure the laxity is really localized to the upper abdomen. You may be a candidate for a reverse tummy tuck, but sometimes I'll look at you and say you actually have some lower laxity that you may not realize, and we might offer a traditional abdominoplasty or tummy tuck.
Okay. That's it.
All right, everybody, thank you so much for tuning in. Hope everybody has a great weekend, and I'll see you next week.
Okay.